Hey, I'm Dr. Christy Sutton, and today we are going to be talking about age-related macular degeneration, which is where you can lose vision from damage to your macula, which is part of your retina. And today, because we're talking about AMD, I'm going to show you my blue light glasses, which you should definitely get a pair of these to protect your eyes from all of the LED blue light that we get largely from screens like iPads, computers, all that. And so get yourself a pair and then get somebody that you love to decorate them. My little 8-year-old girl decorated mine. So they're pretty snazzy. So, okay, if you want to learn about AMD, age-related macular degeneration, how to save your vision from AMD, and then possibly simultaneously save your heart and your brain, because those three are all connected, as I'll discuss, then okay, so do you have the genes that can increase your risk of losing your vision? If you know you do, then you can start doing things to protect your vision. Don't wait until you've lost your vision to find out that you have these genes. Figure it out sooner rather than later and start doing what you need to do. Here's the disclaimer. Let's move on. AMD is a neurodegenerative inflammatory disease of the part of the retina known as the macula. So the macula is actually a nerve. It's part of your nervous system. So this part of your eye is a part of your nervous system. So this is a neurodegenerative inflammatory disease. Much like Alzheimer's is a neurodegenerative inflammatory disease. This just has a different part of the body, different mechanism of action. There's a ton of research that shows that if you have AMD, you're at a higher risk for cardiovascular disease and other neurodegenerative diseases like Alzheimer's, dementia, Parkinson's, stuff like that. So there's an overlap between these multiple different diseases because they're all inflammatory, have lots of oxidative stress. So we're going to talk about what to do to prevent these diseases, which are different but have underlying similar pathways. So with AMD, you can see that in this picture, slowly there's early, intermediate, late, and then blind. And you get this central vision loss that occurs, and it tends to happen in people that are older, so like after age 60 or 65. Now, the macula is the part of the retina that gets damaged, which is the nervous system. And it's a disease that really involves your immune system and inflammation destroying your vision. So age-related macular degeneration is the leading cause of severe irreversible vision loss in people over age 60. And if you look at this graph on the left, you're going to see that is determined, that's expected to increase dramatically. By the year 2050, we're going to have exponentially more AMD, and I don't want that to be you, me, or our loved ones. So let's not let that happen. Currently, AMD affects about 1 out of every 14 people age 75 and older. So this is a big deal. And there's things you can do to prevent it, but you can't make it go away. So prevention is key, and it's expected to increase. So it's expected because many things. We live in an environment with so much vision damaging things like the lights and the phones with the LED, and living in a world with so much oxidative stress. And there's a huge increase in blood pressure issues and diabetes, and all of these things are bad for AMD. So we're going to talk about the genes that can increase your risk for AMD and what to do about it, the epigenetics. So who's at risk? Anyone that has inherited these AMD genes, anyone with a family history of AMD, smokers, people that eat the standard American diet, not enough fruits and veggies, people with high levels of inflammation. So if you're looking at labs, like I look at labs on people, then I'm looking for high levels of inflammation with CRP or homocysteine or other immune type issues that are going to increase their risk for age-related macular degeneration, vision loss. And then all of us are in this world where, you know, being on the phone nonstop is like the new normal, but it's also really bad for your eyes. So previously, smoking was extremely normal and common in society. So that was like the #1 risk factor as far as environmental risk factors. Now, I think it's going to be these phones that are going to end up being a problem. So we can't smoke. We've got to be more careful about our vision. And we're going to have to really be good about protecting our eyes with LED protecting lights and glasses and sunglasses, and wear a hat, those type of things. So This picture kind of shows you some of the risk factors for AMD. So you can have inherited some of these bad AMD genes that I'm going to discuss and show you. And then you cannot have a lot of the environmental risk factors and not get AMD. Your genes are not your destiny. But you can inherit these bad genes, or maybe even good genes, and then you do all the wrong things. You smoke, you have a poor diet, you're obese, you have low antioxidants, low zinc, etc., etc. And you end up losing your vision to AMD because you have a combination of both bad genes and bad environment. So don't let your metaphorical cup overflow. Do what you can to accommodate your genes environmentally so that you don't develop diseases. Genetic predispositions do not determine your health in general. So wear the blue light cutting glasses, wear the sunglasses and the hat. That's all that picture was about. Now, genetic detoxification is a genetic report that I created. You download 23andMe raw data and you upload it to genetic detoxification, and it'll give you like over 300 genetic SNPs, including, tons of things that I'm not talking about here today. Today, I'm talking about the CFH and the ARMS2 age-related macular degeneration genes. And so these are some different people and their genetic types on that report. I pulled these from some of my patients. So occasionally I'll have patients that have inherited all of the possible bad risk alleles for CFH or AMS2. And those are red. They're red for both of those genetic SNPs. These are very, very high risk people. The more yellow and red you have, the higher risk you are. You want to be green, okay? But not everybody is. So what does that mean? That means that for every yellow or red you have, that means you're going to have a higher risk. Now, we're going to go into great detail about some of the idiosyncrasies between CFH and ARMS2, because these two genes do not have the same risks and they don't necessarily respond to the same thing, including medications. So I don't have time to talk about everything about these. I have written a book about this, but it hasn't been published yet. And so there's a ton of information on this. I'm just going to try to kind of give you the highlights here. So the key here is you want to do the genetic testing before you have the symptoms and way before the disease is diagnosed. If you wait until the symptoms start or the disease is diagnosed to find out you have a gene and to start doing environmental things that protect you from AMD, then you've lost this huge opportunity. And the longer you wait, the lower your ability to prevent and protect your body from diseases, including AMD, cardiovascular disease, dementia, cancer, etc., etc. Okay, so there's multiple different stages of AMD, and the typical stages are stage 1, 2, and 3. Now, I added an additional stage 0. So there's no AMD where you just don't have AMD, you don't have maybe any of the genes or family history. And then there's what I made up. I took a license here of creativity. And I said stage 0. You don't have AMD. You don't have any symptoms of AMD. If your doctor looked into your eyes, you'd be just fine. But you have inherited some of these AMD genes I just discussed, and you have a family history of AMD. So these people need to be in the same category as people that have been told that they have early AMD or late or intermediate. So then from that, then you get more subclinical, where you start to get a little bit of drusen and small drusen. And this is just damage that can be seen by the ophthalmologist in your eyes. Now, I just want to say something real fast. The AMD, the American Association of Ophthalmology does not recommend genetic testing, because they say, since there's no genetic therapy, gene therapy, why get tested? Which is stupid. Okay, so just because there's not a genetic therapy, which means like they can't change your genes with some type of vaccine or treatment or pill medication, doesn't mean that you shouldn't know that you have these genes. And it doesn't mean that you can't do something about it. There's tons of things you can do about genetic risk factors. If you know about them, you're much more likely to do those things. In addition, it's very stupid that the American Academy of Ophthalmologists do not recommend genetic testing, because a lot of the drugs that they recommend for people that have AMD don't work very well and actually do more damage with certain genetic types. especially the CFH genetic type. I'm not going to go into all the details like that because I don't prescribe those drugs, but I just think it's interesting that they're really not congruent with what they're saying and what their patients need. No surprise there. So there's the stage 1 early AMD, stage 2 you're getting worse, stage 3 you're looking at real permanent vision loss. You don't want to let it get there. You want to know about your problem when you have no AMD, stage 0 AMD. Okay? Now, like I said, the eyes, the heart, the brain, all of these things there's a lot of research showing AMD is kind of like Alzheimer's of the eye. And that people that are at an increased risk for AMD are more likely to have cardiovascular disease and neurodegenerative disease. And that is not associated with just their age. There is actually a direct correlation between AMD and the other diseases. So if you do the things to protect your vision, you might simultaneously be protecting your heart and your brain. Wouldn't that be nice? So what are the differences between the genotypes? Okay, so the ARMAS2A69S, this is like if you get 1 or 2 risk alleles, if you get 2 risk alleles, the 2 Ts, then you're red on that genetic detoxification report, and that's a high-risk genotype. And so these people have an inability to clear debris because their immune system is not going in and clearing it out. So that's going to lead to more inflammation and destruction. So this is associated with a deficiency in the ARMS2 protein and a decreased ability to remove dead and damaged cells. So then they're going to have more damage and debris and more drusen, and that's going to create more risk of an AMD type situation. So basically with these people with the ARMS2, their sanitation service, their immune system's ability to go in and clear it out is not working very well. And that's why these people with this genotype do really well with a higher amount of zinc to decrease their age-related macular degeneration risk, because that will dramatically increase the immune system's ability to activate a part of the immune system called complement, which goes and clears damaged cells through basically eating them up and destroying them. It's just called phagocytosis that targets them and destroys them. Your immune system does that to damaged cells, which is good. It's like taking out the trash. So if you don't do this, you're going to have more damage, necrotic issues. It's very possible that zinc helps the immune system sanitation service remove the trash or debris better and faster with people that have this genotype. And I'm going to go over what supplements I have patients take that have specific genotypes at the end. Right now, I'm just going through the kind of idiosyncrasies of these so you understand what you're dealing with. Now, the CFH Y402H, if you have this 1 or 2 C risk alleles, then you're at the high risk for that genotype. And then you have basically what this gene does is it kind of modulates the immune system so that you don't have an overactive immune system. And people who have this risk allele, they're at an increased risk of AMD because their immune system is like almost too active. And so they don't necessarily do as well on super high levels of zinc. They can, in some cases, they even do worse. So like their immune system can't really put the brakes on the immune system's complement system, which it then creates more oxidative stress, tissue damage, etc., leads AMD risk. So the current AMD supplements are not enough for people with the CFH Y420H. And how do you know if you're one of those people? Well, you have to do genetic testing. I mean, you just absolutely have to, or else you're just shooting blanks in the dark by taking the typical AMD supplements that have been proven to be effective. Well, they're effective for some people, but they're not effective for everybody. And if you have this specific genotype, they might even be problematic. So this current AMD preventing supplements are minimally effective for people with the high risk, the red genotype on the genetic detoxification report for the CFH gene. So the CFH low risk genotype does great with the typical AMD supplements. The CFH high risk genotype, they only had an 11% reduction in AMD progression or development versus a 68% reduction in AMD development and progression, and the green CFH type genotype on that genetic detoxification report. This is really important to know. Why aren't people checking? I don't know. Among antioxidant and zinc supplement users, patients with the non-risk, that's the green type for CFH, and the high risk, that's the red type for the ARMS2 genotype, had a lower risk of progression to advanced AMD with the typical zinc, high zinc supplements, zinc and some antioxidants. However, there was no significant treatment effect among patients who were homozygous, that's red, for the CFH risk allele. So you've got to check, people, you've got to check. And the same thing for a lot of the medications that they give people. So it's, in my opinion, at this point in time, with the data that is out there, I think that it is negligent and malpractice to prescribe medications for AMD without knowing their genotype, because you could be doing more harm than good. Okay, so in 2001, they did this big AREDS, age-related eye disease study, and it was a big multi-center, double-masked, placebo-controlled trial, blah, blah, all that. And they said, okay, we're going to have a high dose of zinc, vitamin C, vitamin E, beta carotene, copper, and the whole reason for the copper is because a high dose of zinc, like the 80 milligrams that they use, made people copper deficient. So the copper was in there to protect from the copper deficiency, because zinc binds to copper and pulls it out. So then a couple of years later, they did a follow-up study to replace the beta carotene due to an increased risk of lung cancer for smokers. And they replaced the beta carotene with lutein and zeaxanthin, which are now kind of this is the standard protocol now for age-related macular degeneration. It's the AREDS2 formula. So you got the vitamin, a little bit of vitamin C, a little bit of vitamin E, some copper, lutein, zeaxanthin, zinc. And this works pretty well for people that have specific genotypes, like if they have no risk alleles for AMD, or if they just have the AREDS2 genotype, then this will work pretty well. No big deal. However, like I said, the people with the CFH genotype, it doesn't work that well. And so another thing they found was that the omega-3 fatty acids were not all that helpful. Well, they might have been helpful in other ways, but they weren't very helpful at preventing AMD in people with the CFH gene. However, it was really effective at helping to prevent AMD in people with the ARMS2 genotype. So if they were like red or yellow on that genetic detoxification report for ARMS2, then the Mediterranean diet, really high in fish and extra omega-3s, were found to be really helpful for that. So you got to look at genotype here. The Mediterranean diet, although it might be really helpful in other ways for people with the CFH gene, wasn't particularly helpful for people that had inherited 2 risk alleles in that, which is important to know. Okay, so this is the supplement that I use in my practice. This is my brand, Epigenozyme. And actually, we had to change the name of this from ARMS2 Eye Complete to Vision Complete. I just haven't had the photos taken yet, but it's the same thing. It's just the FDA was like, no, you can't do that. So anyways, basically, this has a little bit of a lower dose of zinc, and it still has a lot of the really important antioxidants in it. But it has additional antioxidants like lutein and ginkgo biloba and quercetin and bilberry and alpha lipoic acid and NAC that are and taurine, which are good for protecting your eyes and supporting eye health, regardless of if it's CFH genotype or ARMS2. You know, the thing is, if you have, and in addition to taking this, you should probably add a little bit of extra vitamin C and maybe a little bit of extra vitamin A and maybe a little bit of extra vitamin E, but antioxidants, antioxidants, antioxidants. So if you have the CFH genotype, then, you know, 2 of these a day or so would be reasonable. If you have that ARMS2 genotype where you need an extra zinc, then you're going to want to either take a higher dose of these, like 4 a day, or you're going to want to add extra zinc in addition. And then in addition to this kind of overall AMD supplement that I use for both genotypes, if somebody has the CFH genotype, then I really want to get them on some additional supplements in addition to that previous one I just showed you. The Vision Complete, the ARMS2 supplement, the ARDS supplement. So these can be really helpful for all genotypes, but especially for those CFH genotypes that are kind of hard to treat. And they don't have as much success with the typical supplements. I really like to look at these because, for one, we're looking at homocysteine redox, which has, everything you need to lower homocysteine, which high homocysteine creates neurodegenerative diseases like AMD and Alzheimer's disease and even cardiovascular disease. And if you have done genetic detoxification report, you'll know if you have some genes that create high homocysteine, like MTHFR, etc. And so this homocysteine redox has all of the B vitamins necessary for lowering homocysteine and, methylation support, which is key. I also like the NAC glutathione support because that's a lot of extra antioxidants, which are extremely important for, preventing AMD. And then resveratrol, the epi-resvero, that's been shown to be really helpful for people with both genotypes, ARMS2 and CFH, but especially the CFH people. And then the inflamm redox tamara is essential for anybody with that CFH genotype because they just really need that extra inflammation lowering support. And so this has the curcumin, which is shown to lower inflammation and be effective for that CFH genotype. Now, I talked about fish and omega-3s. Now, if you have the CFH genotype, these haven't been shown to be as effective. They might be helpful in other ways, like helping your brain be healthy or your heart be healthy, but it's really much more helpful and clinically relevant for people that have that ARMS2 genotype. So I have 3 different fish oil supplements that I give people, and I'm just going to kind of quickly break them down. Now, the one on the left is kind of the highest quality in that it's kind of ready to be digested immediately. It's not going to give you that typical like burp up the fish smell. And it's got a really high dose of EPA and a pretty high dose of DHA. And DHA is extremely important for retinal formation and retinal health. So, but this is also something that's going to be a little bit more like anti-inflammatory EPA, which is known to be really good for like lowering cholesterol, that type of thing. Now, the one in the middle is a little bit less absorbable, but it's still really good and it's a lot cheaper. And so this is the triglyceride form, and it's great. It's just a little bit cheaper and might give you that fishy smell. And then the one on the right is very high potency DHA, which, like I said, DHA is extremely important for retinal development and retinal health. So I love all of these and use them interchangeably in multiple people. But for vision health, if I'm just looking at it clinically as far as genes, then I would probably use these more with the ARMS2 people, although I wouldn't have a problem with using them for both genotypes. Okay, so wow, that was fast. This is my book, Genetic Testing, Defining Your Path to a Personalized Health Plan. These genes are in my genetic report that goes along with this book, but they are not in the book because the book was published before I included those genes on the genetic report. However, I talk about almost all of the genes in the genetic detoxification report in this book. I go into great detail about, what they mean, what to do about them, what labs, symptoms, everything, nutrition. It's the genetic, epigenetic. It's, pretty user-friendly, I'd say. It might look like a textbook, but it really reads well for the lay person too. So check that out. And if you need my information, here's my info. If you want to, schedule to go over your information or anything. So it was a pleasure. Thank you for your time and good luck and stay healthy.